Hello, everyone. Good morning. Welcome back. I'm Steve,
And I'm Scott.
and together we are Backyard Musings.
And we are talking about a nasty critter.
Yeah, you can see the
And
offending beast right here.
yeah, and we're not talking about the California legislature or the governor. So, but
This
close.
this dude looks like he has a tiny little pinhead and a big body. It's crazy.
Yeah, kind of looks like Gavin Newsom.
A little known disease is spreading in the U.S., primarily in the state of California. Health officials warn. In a new study published in the CDC journal Emerging Infectious Diseases, researchers state that human cases of Chagas disease, that's spelled Chagas, Chagas disease, have been confirmed in 8 states, leading them to recommend that the disease is classified as endemic. Quote, acknowledging the endemicity of Chagas disease in the United States is crucial for achieving global health goals, the authors wrote. Would you like to know more?
The Center for Disease Control and Prevention defines a disease as endemic when there is a constant presence and/or usual prevalence in a population within a specific geographic area. In other words, the baseline level of disease within a community. Chagas disease or American trypanosomiasis, okay, I hope I got that,
I think
is
you got it.
already okay, is already endemic in South America and Central America, but it is now spread to the southern U.S. where it is taking hold among insects and animals. So, gee, I wonder how that got here.
Yeah,
Great.
I wonder. Chagas disease is a parasitic illness spread by triatomine bugs, also known as kissing bugs, according to the CDC.
Daddy, I'm gonna go to my house.
Okay. The disease is transmitted when feces from bugs infected with the T. cruzi parasite enter a person's body, specifically through a bite wound or contact with eyes or mouth.
This is disgusting. Quote, when the kissing bug takes a blood meal, it will eventually defecate and leave the feces somewhere. Lead study author Dr. Norman Beatty, not Norman Bates, but Norman Beatty, assistant professor of medicine at the University of Florida College of Medicine. To go on with the quote, sometimes it can poop on our skin or mucous membrane while feeding, and then the parasite enters at that site. The bug's feces can also end up inside or near a home, and then it be incidentally ingested or rubbed into the skin or mucous membrane, unquote.
So this is a parasite from the poop. So these bugs are pretty small. The parasite is
It looks
like,
like a tick.
well, that's the bug. They're
I,
saying the parasites in the feces. So
yeah,
it's
no, I
even
get that.
smaller.
I get that. So yeah, so even if the bug is in your bed, it's going to poop on something. It could poop on the sheet. It could, and then you roll in it, or it could poop on a napkin that you're going to wipe on your mouth, or it could
Yeah,
poop on somebody's food, or. But that thing looks like a tick, does it not?
it does. Yeah.
Okay, great.
Transmission in the United States can also occur from congenital infection, where a chronically infected mother can transmit the parasite to a fetus, or from organ transplantation, according to Beatty. The first stage of Chagas disease, called the acute phase, happens shortly after infection. It is followed by the longer term chronic phase, according to the CDC.
The disease does not always cause illness, but some people can experience symptoms. Quote, Chagas can lead to fever, fatigue, rash, body aches, and lymph node swelling, and later can lead to digestive issues, heart problems, and neurological involvement, unquote, by, is this guy a doctor, a person a doctor, Dr. Siegel?
Yeah.
Is that what we said?
From the Fox, yeah, Dr. Siegel from Fox.
Yeah.
Scott,
he's
you sound,
a good guy. He's a good guy.
yeah. So you said you really don't like this. Do you have any of these symptoms,
No,
Scott?
I do not. I do not. But when
Okay.
I was reading these notes earlier, I'm immediately thinking, okay, so let's say, and I'm not trying to pick on our southern neighbors, but they're saying that this comes primarily from south of the border, Central America, South America. So over the last 5 years, maybe more than that, there's been a huge migration.
16 million people, 20 million.
Yeah. Okay.
Let's say
So what are
1% has carrying it.
okay. So what's the percentage of a few of those people coming over here and staying in the same hotel that I stay in, or going to the same restaurant that I go to, going to the same market that I go to, and
I don't know.
dropping these things, and then bringing them with them, and then dropping them.
I don't
And then
know.
this is not good.
For.
This is not good. I mean, I could see where this could turn into a pandemic really quick, and I don't want that, especially the digestive issues, right?
I know. Yeah.
Okay.
Another hallmark of the disease is eyelid swelling, also known as Romagn's sign. In the chronic phase, about 20 to 30% of people with the infection may experience potentially fatal heart issues or serious digestive problems, the CDC states.
Okay, and why are we not hearing about this on Fox News or
well, this is a Fox
media?
article. It's a Fox article, so they published
Yeah,
it.
but I'm just saying, we should be hearing that. This should be being blasted all over the place.
I agree.
This is crazy stuff. Approximately 300,000 people living are living with Chagas disease who acquired the infection in Latin America and the U.S., according to Beatty. Quote, however, the exact number is unknown. Great. A national prevalence study has never been conducted. The disease is more likely to occur in states where the kissing bug is found close to where people live, which includes parts of California, I'm sure probably close to the border, right? Arizona, Texas, Louisiana, and Florida, according to the expert.
And so here's another quote. What really matters is whether the kissing bug has been found invading homes and harbors the parasite that causes Chagas disease in a particular region, he said, adding that researchers are just tipping the iceberg with their understanding of locally acquired disease in the United States.
Another quote. Unfortunately, most of the United States is unaware of the silent killer and the fact that it is spread by a bug, he said. Our first steps are recognizing that this is an endemic infectious disease, building on improved education among the public and healthcare providers, and allocating funding for research and programs to support testing and additional monitoring. The expert refers to Chagas as a neglected tropical disease. Great.
Quote, our hope as a team researching Chagas here in the U.S. is that we bring awareness to the fact that this infectious disease is being transmitted here and can be deadly. More research and resources are needed so we can help mitigate transmission to at-risk communities, especially those living in rural and agricultural sectors, end quote.
In most circumstances, Beatty said, people are bitten by the bug in their bed or home. Quote, from there, a person will reach out with a picture of that bug, and we start the process of testing and educating on how to prevent the insect from getting in the home and deterring it from wanting to be around a human dwelling. Okay. Nuts. This is just
go around. Lab screening tests and treatments are readily available, Beatty said, but clinicians are largely unaware that the disease is being transmitted in certain communities. There are 2 anti-parasitic drugs involved for the treatment of Chagas disease in the U.S. Benznidazole and Lampit. And the technical name for Lampit is Nifurtimox.
Okay, another quote. Currently, there is a clinical trial being conducted to assess a new agent for the treatment of Chagas at certain centers in the U.S. and Latin America, Beatty said. There are no vaccines currently available to prevent the disease. It can be a challenge for patients in rural America to find a provider who understands this disease, Beatty noted. Quote, in my clinic, people have traveled from other states to see me in Florida just because they have no one else near them willing to care for them, according to the researcher. Again, a quote, it is essential that we start educating our future clinicians about Chagas disease and ways to test, treat, and manage those infected. I'll say.
Beatty also shared some tips for preventing kissing bugs from entering the home. That includes removing harborages of nesting animals near a home where rodents would reside, such as piles of wood or clutter, sealing up door jambs, window seals, and other entry points, as well as placing screens on windows and doors, can also be effective. Beatty also recommends judicial use of residual pesticide spraying near potential entry points like door jambs and window perimeters.
Okay,
Wait,
so
oh,
it sounds like it can be transmitted uh, by rodents, and then what? The bug finds its way into your home.
yeah,
I don't know. This is pretty scary stuff.
yeah.
Anyway, thanks
We
for
just had
bringing
an
this to our
ant problem in our main bathroom. The little tiny ants. The dude called them, the eradication dude called them Argentinian ants.
Taro.
Taro?
Terro, Terro. It's a liquid like a borax material.
Oh,
You drop it there, they just munch on it, and they take it back to their nest, and within a day or two, maybe 3, all dead. I'm telling you.
wow.
And they're not a sponsor, they should be. It comes in a little tiny bottle. All you need is a few drops of this stuff, and they are all over it. Yeah, they're probably coming in for moisture or
Yeah, looking for water.
looking for more. Yeah, because it's been so dry. But yeah, that's the stuff, man. You can get it anywhere. Walmart, Home Depot, Lowe's, good
Yeah.
stuff. Taro, Terro.
All right. Thank you, folks, for joining us. We'll catch you in the afternoon.
Yep, watch out for the Chagas.